Returning to our top story, and Labor's had its first state victory in 12 years last night, which will mean Tasmania is the only state not to lead by a Labor majority. Well, joining me live is Chief Advocate for National Seniors, Ian Henschke. Hello to you, Ian. So what's this going to mean in aged care, seniors and health and other areas across the country?
Well, it's an opportunity for the federal government to deal with the states without too much pushback, because if they're dealing with Labor governments around the country apart from one state, they could look at things like health costs in Australia. Now, the Labor Premier in South Australia has only been in for about 1 year now, Peter Malinauskas, who's been in the news today. He gave an address just recently where he said that a third of the state's budget was on health, spent on health, and that was likely to rise to about half the state budget. And he was calling on a new arrangement between the states and the Federation on how they can fund health and way they could do it more efficiently. So I think there's an opportunity there for the federal government to talk to the states and say, can we do things better and more efficiently in health? And of course, at the moment, with aged care issues, a lot of older Australians are in the hospital system when they should actually be looked after better in an aged care home, and sometimes they're being moved from an aged care home into the hospital system. So there's a lot of cost shifting going on. So there's great opportunities there at the moment, I think, for the federal government, the states, to sit down and say, let's look at that. Another one, of course, that's happening, and it's happening this week, I believe, in Parliament, is there's a call to have a uniform Retirement Villages Act around Australia. And part of the problem there is every state goes its own way. And once again, you could have national legislation. I think Rebecca Sharkey's looking at that. The Independent from South Australia is looking at that this week. So there's ways that we can improve things without it costing the budget. And of course, the big one is the jobs issue in Australia. The two big issues I see apart from health are jobs, filling in those vacancies, and also housing. But let's just take the jobs one at the moment. There are more than 440,000 job vacancies. Last year, there were 480,000. So we're only seeing a very small movement in that. We've still got the lowest unemployment in decades. And yet we still have this system in Australia where if a pensioner who is under the income test, in other words, they don't have much super, they go out and they work. When they work more than 1 day a week, they lose 50 cents in the dollar from their pension and they pay income tax. And that has to end. And we're saying in the upcoming budget, they have to fix this problem. And I would like to see the state governments actually saying we need the workers and putting pressure on the federal government. And I know that there are many states around Australia who are desperate for workers. Western Australia has a very severe worker shortage. We've got worker shortages in education, in nursing, in healthcare, disability care, childcare, all those areas. And yet we've got pensioners who, when they work, they get punished. So I go back to this policy that we've been pushing for 3 years. Now is the time. There is no better time for all those states to sit around now in concert and talk to Mr Albanese, Mr Chalmers, and say to them, why won't you do it? Even if it's just for a 2-year trial while we've got this desperate shortage of workers, let the pensioners, the veterans and others work without severe penalty, because it's a big problem in the country indeed. And then you've got housing as well. That's the other issue, that maybe now that you've got all these Labor governments together around the country, a national housing policy so that they can sort out some of these issues between the states, because it's not just young people that are starting to suffer from the housing crisis. We know that there are many older Australians, particularly those that are on pensions, who are being moved out. I had a call the other day about a group of 50 people being moved out on the Gold Coast because the rental affordability scheme that they were under has finished, and these are 50 people that are being effectively put out and say, go and find somewhere. I was speaking to someone the other day who's got a daughter who's a teacher on the Gold Coast. She's been moved out of her house. So it's young and old affected by housing. So these are very big issues that have to be addressed. And if there's a benefit that comes from having the whole of the country under one political party, effectively, apart from Tasmania, and I think the Tasmanians would want to fix the same problems: health, aged care, and housing. They're big problems. And of course, Janie, the other one that's there is how do we fund aged care? Maybe it's time for the states and the federal government to sit down and say, let's have an independent body, look at how we fund aged care, the best way to do it, and then get these things solved. Because we have to fix some of these problems. They're big problems.
Well, they certainly are, and you make some excellent points there. And in terms of the pensioners and the veterans wanting to get into the workforce a little bit more, have you got any stats on how many actually would like to? And can you give us perhaps an example of somebody who would make that extra bit of money?
Well, we did a survey last year and we found that 20% of those people receiving benefits at the moment would like to rejoin the workforce. Now, that's a big number. I mean, let's just take the number of people that are under the income test on the pension. There's 1.1 million. So you're talking about the potential of 200,000 workers there. That would solve almost half of the job situation at the moment. Now, I'll give you an example. If you were a nurse at the moment and a nurse was on the pension and she reaches pension age in July, which goes to 67, if that nurse said, look, it could be an aged care home or a hospital saying, look, we need you to keep working. Now, if she works and works a full year, then that nurse will pay income tax on the pension plus her wages. She will end up paying back more than the pension in income tax, so the government wins. She will end up being a nurse for an extra year of work, and she might want to work, or he might want to work. We've got male nurses, female nurses. So they may well work for another year or 2 years. They get more superannuation. They provide the nursing that's needed, and we desperately need those nurses. And then, of course, the government wins, the individual wins, the health system wins. How can you fault an argument like that? And this is why we keep saying to government, sit down and talk to people who are in the nursing profession. There was a nurse that met Mr Dutton last year. She was a dementia care nurse, and she convinced him just in a morning conversation that he needed to broaden the policy. The policy for the Liberal Party was, and the National Party was, that they wanted to double the pension work bonus. After speaking to her, he said, if the government wants to go further, we wouldn't oppose it. So in other words, I think that the message is getting through, but you've got to be able to make that change so that people can feel confident that they've got a fair system, that they've got a better system, and they'll come out and work. And Janie, we only have to look to New Zealand. In New Zealand, 45% of people between 65 and 70 are still in the workforce. In Australia, we've got about 15% that are actually in the workforce. So we could be doing far, far better, but you've got to set the policy settings so you don't punish someone for working, you reward them. It's easy to actually look at that system in New Zealand and say, if we had that here, would we get the same result? My prediction is yes, but more importantly, National Seniors asked its own members to fund a Deloitte modelling study. Deloitte's have turned around and said that what we're saying stacks up economically. They're the Rolls-Royce economic modelling agency the government uses, and we've given that information to government, and we're saying to Mr Chalmers, Mr Albanese, and all the ministers that are there, you have a jobs crisis. Here is a part solution, and older Australians want to be part of that solution. Let them do it. Let them work.
All right. Well, we have to wrap it up there. Ian Henschke, always great to chat to you, and good luck in May. We'll talk to you again and find out the outcome. Thank you so much.
Well, five weeks to budget day, and we've got our fingers crossed.
All right. Good luck.